everyone, my name is Adele Bartram Goodall and I'm from the Laser Lady Australia, and we're at Body Recon Cosmetic Clinic here in Geelong, Victoria, Australia today. And I'm going to show you guys how I like to perform a multi-modality skin tightening and skin rejuvenation procedure using the Fotona SP Dynamis and also the Fotona QX Max. Both are fabulous medical grade systems made in Slovenia in Europe, and I'm very lucky to have these toys at my disposal. So the patient here, she is in her 30s and she's just wanting a light freshen up with her skin. I do believe that non-ablative laser is very much underutilized, purely for the fact that non-ablative laser is great because patients can go back to work straight away. They can see results. They're obviously going to have multiple treatments, which in turn means good revenue for the business. And also the patients love it because it's not painful and it's something that they would recommend to their friends because they quite enjoy coming in and having the treatment done. It's something that they also need maintenance treatments for. So again, and as a business point of view, it is a great type of treatment to offer for your patients ongoing, to retain the results that they've had either from a course of non-ablative laser modalities or a singular or multiple treatment of ablative or fractionated ablative technologies. So the patient here, we've got some disposable eye shields on her, and we're going to get started. So the first treatment that we're going to use on this lovely patient is FRAC 3 laser, which is a multi-stimulated NdYAG laser, and it works just by creating a gentle heating process in the skin. I love FRAC 3 and I consider it more of a warmer type modality, so it really gets the skin up and pumping. The patients love it because it creates that nice gentle heating sensation in the skin without stimulating it too much and without delivering too much heat initially at the start of their treatment. It also means that when we come to do the tightening procedures, such as the piano mode and the smooth mode, that we don't need to work quite as hard to get to the desired temperature. So a really lovely treatment. You can use it as a standalone treatment, but I prefer to use it as a multi-modality approach. So I would use it as a warm-up treatment before proceeding to other modalities. I'm going to use a slightly low fluence with this patient, and we are going to be using the Fotona S11 handpiece using a 6mm spot size on OP settings. So 1, 2, 3. How does that feel, Kat?
Fine, good, just warm.
And we can see from that we are still getting a nice even temperature with the skin. So that's what we want to achieve with FRAC 3. So that is your FRAC 3 using Fotona NdYAG. So now we're going to progress with some piano mode using the Fotona NdYAG. Piano mode works by creating very long pulse durations into the skin. So we're talking seconds rather than milliseconds. So the benefit of doing this is that it's a safer treatment, and it also means that we can get a lot of energy into the skin at a deeper rate and still make it a safe treatment. It's great for collagen and elastin production, and it's also great, we've had studies proven that it is good for a moderate improvement in terms of texture and tone of the skin, but also a slight improvement in pigmentation. It's not my go-to treatment for pigmentation, but they have proven that you do get a slight improvement in that. So we are going to be using the R34 using a 20 ml spot size. We can see as well that we are getting a nice even heating distribution in the skin. Ideally, we want to keep the treatment between 42 and 45 degrees Celsius per area. So we like to heat that consistently as well. Again with our green toning protocol. Green toning is a treatment that I developed purely because I saw a niche where we needed to treat with a qswitch NdYAG to treat dermal pigmentation, and then also layer it with a qswitch KTP, which is in turn going to target the topical pigmentation and the microvascular component to conditions such as melasma. Also in Australia, a lot of our patients have a lot of photo damage. So whenever they have that pigment plus the vascularity component, it is good to target it with both modalities. It's something that we can combine with tightening again as well to make it a complete multi-modality type treatment. This protocol I call tightening and lightening, and patients love it. They love that it's a catchy name, and they want to tell all their friends that they've had tightening and lightening with me. So when we do the qswitch NdYAG, we're using the Fotona QX Max, and we're going to use relatively low fluencies. The reason we want to do this is because we just want to create a lighter type treatment for the pigmentation. If you were wanting to really combat and target different conditions, you could easily increase your fluence. But today we are just going to use very conservative settings because the patient, she simply does not need high fluence. So that's really important as well, assessing your clientele and working out what is required for them. We also like to use the Zimmer cooler, which is just going to blow some nice cold air onto the patient's skin and make it really comfortable for them. require KTP laser. However, for demonstration purposes, we are going to do a small amount of KTP, which is using the Fotona QX Max, using a 532 nanometer. The reason that I want to demonstrate this is to show you my technique. So with both green toning protocols using the qswitch NdYAG and the qswitch KTP, I like to use an airbrush motion, which is just a really light, gentle motion using low fluence. 1, 2, 3. So now we're going to finish off with some smooth mode NdYAG. We're using the RO4 handpiece, and with the smooth mode I do believe it is a really underutilized modality again as well. Purely there's a lot of research to show that it is a fabulous mechanism to work by targeting and tightening the skin. All of my patients love it because they walk out of here and they feel and look tighter and rejuvenated. I prefer not to use the smooth mode generally on an ablative setting. I think you don't need to be too aggressive with smooth mode. I know a lot of other doctors will want to come in and give their patients a light peel. The majority of our patients do not want to have any downtime. So that's where smooth mode is fabulous. You can use it as a lighter type treatment where they will have no downtime, or you can combine it with a light peel or a NdYAG fractionated treatment as well. Today, we're just going to use it as a light tightening treatment with no ablation. Again, we're using an airbrush motion and holding away from the skin. I don't want to see any ablation. 1, 2, 3. Stapling the skin. You'll see that I'm pulling the patient's skin. We want to staple it into position, and things we're looking for are light erythema. Now we're just going to finish with some post-treatment serum, and the patient, as you can see, has a small amount of erythema. That erythema usually dies down in about an hour or so. We can also apply mineral makeup straight over the skin as well, so the patient can return to work or head out to a party, as this patient is later on tonight. So we can see, come on, nice and close. So you can see just that light erythema that we would expect from the tightening and lightening procedure, but very comfortable. How did you find the treatment, patient?
Really nice. It was just warm and wasn't painful at all. Really good.
Thanks for watching my very first Laser Lady Australia video. I'm hopefully going to be posting more videos at a regular time, so feel free to like, comment down below, and don't forget to subscribe so you don't miss out on any of the action here at Laser Lady Australia.